5 new cases of COVID were diagnosed in the 24 hours to 8 p.m. last night, bringing the total number of cases in New South Wales to 3,782. Pleasingly, there were 28,767 tests in the 24-hour period, so thank you very much for community members responding to our call out to get tested. Of the 5 new cases reported to 8 p.m. last night, 2 are returned overseas travellers in hotel quarantine, and 3, all located in southwestern Sydney, are locally acquired, including 1 who is a household contact of a previously reported case associated with the July funerals cluster, bringing that cluster to 74 cases. And 1 case is an outpatient at Liverpool Hospital. That's a lady in her 60s, and she was mentioned yesterday in the press conference. Links with other cases and the source of infection are being investigated. We're looking at community exposures as well as any links to any previous cases that have occurred linked to Liverpool Hospital. And there was also 1 gentleman in his 20s who, again, source was unknown, but investigations are underway. Public health action has occurred with his close contacts being tested and also isolated for that 14 days. In relation to our ICU, we have 8 COVID patients in intensive care and 5 of those are ventilated. So just again to reiterate that message that this is an incredibly critical phase in our response. We are seeing these continual low levels of transmission, particularly in southwestern Sydney, but also popping up in Western Sydney from time to time. It's critical that we continue to see those high testing rates. It's important that the community continues to embrace those COVID-safe behaviours such as social distancing and wearing a mask when you can't socially distance.